Hey everyone, Dr. Soni here. Thank you for joining us for another session where I inject one of our lovely clients live. And today for this young lady, she's 26 years old, we're going to be injecting her lips. This is the first time she's getting lip injections, but our entire goal is to really make the process comfortable. And I'm going to actually go from start to finish, including how I actually numb the lips. So first thing what we're going to do is we're going to start just cleaning the area. The most important thing when doing any kind of injections, and we've already kind of discussed the type of lips that we're going for. This young lady has really nice architecture to the lips. They're a little bit smaller in terms of her perception. Remember, no one really needs to do any of these things, but if someone does want to enhance them, our job is to really make them natural looking, and they also need to be appropriate to the lips that someone had in the past, as well as with the entire architecture of the face. We never want to create such large and quick shifts in volume that we're going to start attracting negative attention. So first things first, we're just going to clean the area, and I like to clean multiple times. As you know, when we do these types of procedures, we want to mitigate any risk of infections or anything like that. And cleaning the area is really going to be of paramount importance, especially if there's makeup on. One of the things we can also do is typically have the patients, really clean and wash the face themselves. I love it when people come in without actually having any makeup on, but that usually rarely happens. Everyone has busy lives. Sometimes they're coming from work, sometimes they're going to work. So I certainly understand that. But again, most important thing is we really want to create a clean area, a clean substrate from our injection. So again, this is just a preliminary cleaning. I'm going to be numbing her up first, and we're going to talk about that, how I numb my patients up. Some places will just use a topical anesthetic, and that's perfectly fine, but I find that, other patients I've taken care of that have just had topical anesthetics, it still hurts quite a bit. So I find that doing a local block gives me several benefits. First, the patients are a lot more comfortable. So you're going to feel a tiny little pinch, 1, 2, 3, pinch. And a little bit of stinging now. A little bit of stinging. So right now what I'm doing is I'm actually on the outside injecting a little bit of lidocaine with epinephrine or adrenaline. Because I'm only going to have 2 points of entry. For her, I'm going to be using Juvederm Volbella, which is a lovely product for the lips. Really creates very natural looking lips without creating too much fullness. And I'm going to be using microcannulas, so that's going to help. Tiny pinch. And these 2 areas, stinging, these 2 areas are going to be my entry points. Now, there are more than one way to really inject the lips. Sometimes you can use needles and just go directly into the body of the lips. Sometimes I'm sure you've heard of things like the Russian lip technique, where you're creating more of the vertical kind of injection points to really create a height. I find that using microcannulas, we can actually, if you're in the right plane and right depth, you can actually create similarly beautiful results. So what this is additional lidocaine, and just like a dentist, we're going to give her a little bit on the inside. 1, 2, 3, tiny pinch. Great job. And now, when we typically do the topical numbing, remember it can take 20, 30 minutes to get adequate anesthesia, and even then sometimes people complain that it's still painful. Tiny pinch. With this, it takes me about 3 minutes or so to give adequate, to finish the numbing process. And the anesthesia is almost immediate, and it tends to be a little bit more complete. So the benefit to the patients are that it's a much more tolerable procedure, much less pain. The benefit to me is that they're moving a little bit less, and of course I don't like to see my patients in pain. And when we numb the lips, this typically is not a painful procedure. Yes, there's a little bit of pinching and discomfort, but in general it's very well tolerated, and I think most people actually appreciate the anesthetic. So we've done the top. One of the other concerns, sometimes I hear from other injectors, is that you're going to distort the shape of the lips by injecting the anesthetic, and that's simply not the case, because I'm really kind of injecting more in kind of the recess of the gum line higher up. So as you can see, the lips stay the same size. We're not really affecting it, and they should be starting to go numb, or if not numb already, and they're going to feel big and wonky. Tiny pinch. So now what we're going to do is do a little bit on the bottom as well. In general, for most people, I will put fillers both in the top and bottom, unless there appears to be a significant discrepancy. If someone, for example, has very thin upper lips and a fuller lower lip, then we'll certainly focus a little bit more on the upper lip. But in general, when someone already has the appropriate ratio in terms of the height of the lower lip to the top lip, then I tend to do roughly equal amounts to the top and bottom. And in general, when I do inject, I don't start with more than one syringe at a time. If you're going to build lips, especially if you're starting with smaller lips, sometimes it can take several visits, 2 to 3 visits. And you really want to give the lips a chance to settle down and heal in between. And sometimes I may actually wait as much as 2 to 3 months. Other times, if they're smaller to begin with, I may wait 2 to 4 weeks and re-inject. We're going to disinfect one more time. This is a little bit of chlorhexidine. How's the numbness?
It's good.
Okay. A little bit hard to talk?
Yeah.
Okay, good. Well, that's how we know that the anesthesia is good. And what we're going to do, as I said before, is we're going to use a micro cannula. We're going to come in from the side and just enhance the top. I always like to start with the vermilion border and then the body of the lips. And same thing on the bottom, vermilion border and body of the lip. The top tends to have 3 tubercles, or areas where there's a little bit more prominence. So it has 2 tubercles on either side and then a central tubercle. And then on the bottom, it has 2 of these tubercles, areas where you can see a little bit more fullness. Just a tiny little pinch there. That's our site where we're going to go in. We're going to prime our cannula. And then this is the area we want to come in now. One of the most important things is you really want to be, tiny pinch, my dear. Good. You really want to be superficial. And you can see the tip of the cannula is right there. I'm just going to gently start to add, and you'll see the lip start to actually lift up a little bit. And that's what we want to see. I don't like to put too much product on the lateral aspect. The lateral aspect naturally tapers down. We don't want to create the same level of fullness everywhere else. And now I'm going to come more in the body. Put just a little bit over here. And again, you can see she's comfortable. We're going to come back, put a little bit more, and we're almost done. For most people, it's about 1/4 of a syringe per quarter. that side is done. I'm going to come back out. And now using the same point of entry, we're going to go after the bottom lip. Tiny pinch. Great job. And now you can see that white tip is where the cannula is. We're going to build the center. And you'll see the lips pop out just a little bit. You can see now cannula for sure takes a little bit more patience to do. There's a little bit more of a learning curve, but in my opinion, it really is a gentle, safe way to do filler injections. Now, there are times when I will still use a needle, and sometimes in the same patient, I can use multiple different techniques. The first time I may just start to build a little bit more of the lips with the cannula, and next time we may do, a needle technique to start building a little bit more height, perhaps. And so there's no real right or wrong way to do this, but one of the things, as you can see, is she's quite comfortable. Mm-hmm. We've injected the left upper, left lower. Now we're going to go, the right upper, right lower. Now we're going to go after the left side. So this will be my entry point. And I really want to stay superficially. And you can see the tip is right there. We're going to start with laying down product, and you'll kind of see that lip start to lift up a little bit. And we're going to come drop it just a little bit underneath it into the body. Build a little bit there. And put one last little thread. And again, very controlled, very measured. And that's it. Top is done, and we're going to just take a look.
Someone commented, "Oh my God."
Oh my God. And here's the last little bit, the lower part. We want to stay superficial. Good job. And you can see the tip of my cannula in a little bit right here. You can see that white dot. By staying superficial, we really create and accentuate the natural tubercles, and we don't really create that excessively protruding type of look. And again, I'm using Juvederm Volbella right now. It is FDA approved for the lips. It's a very beautiful product. And we're almost done. And this is the last little bit. So we're finished. As you can see, very little pain, very little bleeding. Obviously there's a little bit of swelling that's starting to develop. We'll kind of massage this out. A little bit dehydrated on the lips, so the recommendations are just to drink plenty of water and maybe use a little bit of Aquaphor or Vaseline. They are clearly swollen. When everything settles down, again, it really should be a beautiful, subtle response and an effect. Whenever we speak to someone, we always look at their eyes and their lips. You never want to have people just either looking at your lips or your cheeks. The face always should remain in balance and in harmony. And by doing smaller amounts, especially when we're starting with some younger patients, and sometimes it may be prudent not to do anything at all. So, I invite you to come to Ethos. We've been doing this for almost 2 decades, and we're good at what we do, and we don't lead our patients astray, and we always make sure that when they walk out of here, they look like the best versions of themselves. Thank you for joining us today.